It's up to you whether you leave your camera on, Kev. Honestly, it doesn't matter.
I got people going back and forth, John. It's busy.
Okay, no worries. I was going to say we've done the pre-meeting, obviously, but if you've got questions you want to ask, then just feel free to chip in, okay?
Yeah, no problem at all.
We've started the recording now, Chair.
Thank you, Neil. Cheers. Right, well, officially then, welcome to everybody to the Partnership Scrutiny Committee meeting. I've got the usual formalities to read first before we do anything else. I just want to apologise for sharing this online. It's not something I would normally want to do. Just unfortunate circumstances, unfortunately. But anyway, I'll just read this out. This Scrutiny Committee meeting is being conducted on a hybrid basis in accordance with the Local Government and Elections Wales Act 2021, which will operate alongside the Council's standing orders. The Council's standing orders and code of conduct will apply at all times, and members should conduct themselves accordingly. Please can those attending online switch off your cameras and mute your microphones when you're not speaking to ensure there's no unnecessary background noise. Can I also remind members to ensure their chat function is switched on and to use that facility to indicate to me when they wish to speak on a particular item. Please do not speak until I invite you to do so, and remember to unmute your microphone and switch your camera on. A recorded version of this meeting will be uploaded for public viewing as soon as possible after the meeting. Welsh translation of the proceedings can be provided upon request. The images and sound recording may also be used for training purposes within the council. Right, so onto the agenda then. First item we have is apologies. Neil?
Apologies from Councillor John Jones and Ben Davis, Chair.
Lovely, thanks very much. And declarations of interest. Do we have any declarations of interest?
Yes, Chair. If I could declare an interest in this matter, and just if I could just thank members of the RPB for their support during my tenure on the RPB, and especially the chair at the time, and Tanya, for stepping in during a particularly difficult family period for us. And if I could as well, just thank the dementia services, who were an immense source of support as well during that period. So if I could just especially say as well, I'm overjoyed really that Tanya's actually decided to join Newport. So that's a fantastic catch for us, really. So thank you.
Oh, that's great. Thanks, Councillor Hughes. Obviously, with a declaration of interest, if you want to leave the meeting, that's absolutely fine.
Thank you, Chair.
Thanks very much. Right, so the main item on the agenda then is the Gwent Regional Partnership Board, the RPP, their annual report 2023-24. Can I just check, Neil, have we got Councillor Lacey with us?
No, Chair.
No, right, okay. No problem. In that case then, if we could just go straight on to the officer presentation, is that going to be Tanya delivering this?
And then Catcher Harris as well, please, Chair.
Right, okay, thanks. So I'll just hand over then. Thank you very much.
Thank you, Chair. I think Natasha is going to lead on the presentation, and I'm happy to come in and answer any questions that members may like to pose.
That's lovely. Thanks very much. I'll turn my camera off for now, but thank you.
Okay, thanks, Tanya. Thanks, Chair. I'm hoping you can all hear me. So good afternoon. The report that we've sent through for review today is the draft annual Regional Partnership Board report, which we bring to you each year for comment. So as you'll be aware, we complete a population needs assessment, and the last one we completed was in 2021, which highlights the needs of our population across the region around their health and social care needs. Subsequently, we developed an area plan, and this was developed to identify the priorities that we need to take forward as an RPB and to meet the needs of that population needs assessment. So it technically is our action plan of the work we're going to do. So we work collaboratively across Gwent to work on these priorities, and we report progress each year to the Regional Partnership Board, Regional Leadership Group, the 5 councils and Welsh Government. So the area plan is a living document, and it's reviewed quarterly through each of the 7 strategic partnerships that the RPB oversees. And this allows us to address any emerging themes or changes in need that are coming through. So this report has been developed on a regional footprint, and it highlights projects and works that is being taken forward across Newport, Torfaen, Caerphilly, Blaenau y Gwent and Monmouthshire. And we've been doing lots and lots of work on the back of what Councillor Hughes just said. It would be sort of a shame if I didn't mention that Newport was the chosen area for us to do extensive engagement work around the dementia agenda with the communities. So we've been working in Newport for the past 2 years, looking at what dementia care looks like for people, and getting the experiences from people living with dementia, their families and carers, to help us sort of change and improve what a good life looks like living with dementia. So I hope that's a helpful introduction to the report, Chair and Council, and happy to take any questions on that.
Sorry, Chair, you're on mute a second. And also Councillor Lacey will be joining us shortly as well.
Sorry, Councillor Marshall, I missed that second bit.
I've had a message, Councillor Lacey will be joining us shortly. She's just going from one appointment and will be joining us on Teams shortly. Okay, lovely, thanks. Right, just before we take questions for Natasha, I was just going to ask, is there anything else that, any other part of the report that's going to be delivered by anybody else, or are we going straight to questions?
I think we're going to go straight to questions, Chair, because the report in itself is quite a detailed document. There's a lot of good information in there, which I'm sure members will have had a look at. So opportunity for members to now ask us questions, if that's okay.
Yeah, absolutely fine. Yeah, I mean, we had a pre-meeting earlier and we were saying that depending on the level of detail in the presentation, there were questions that may or may not get answered. So I think that probably will provoke a few more questions now. So, Councillor Screen, can I go to you first then?
Yeah, thank you, Chair. Just say it's a very detailed report, and it does make some very interesting reading, and the good work that's being done in this area, needs to be stressed. The question I got is, in terms of training and development of staff and carers, how are the training needs assessed? Are they assessed every year, or are they assessed when there are changes in legislation or practice or whatever? And secondly, are these formal or informal types of training and development? Are they in-house or are they external forms of training and development? Does that make sense? Okay, thanks. Yeah.
Absolutely, Councillor Screen. And maybe if I can start off, and then if Natasha wants to add to that. So in relation to training and development, we have a regional workforce board, which is chaired currently by the director of Torfaen. So as directors and heads across health, we take responsibility for chairing the various partnerships that sit underneath the regional partnership board. So within that workforce development board, which is where our partners bring the information together about the needs of our workforce, both across health and social care. So certainly I can talk to you from a local authority perspective on what we do in relation to identifying the needs of our social care workforce, because we've got a specific social care workforce team in Newport, and they undertake an analysis of the training needs of our workforce. That gets fed into the regional board, and then out of that, various training programs are then developed, and it's a mixture of both formal and informal training sessions. So some of the training we may commission from external providers if they've got that level of expertise. But I think we need to recognise that there is a lot of expertise that we have within our workforce, and they can very easily deliver training. Our more experienced staff can deliver training to our less experienced staff. So it is very much a bit of a mixture between the formal and the informal. I hope that answers your question.
Yeah, just on that point, are there, do these include national qualifications?
It depends very much on the needs of the workforce, but yes, it can do. So, for example, I can relate back to what happens in local authorities. So you'll be aware that there is a shortage of social workers nationally, and obviously the social work qualification is a national qualification, and a number of the authorities across Gwent do what they call a grow your own project. So effectively they look at the workforce in social care who would aspire to become social workers, and then those social workers are supported through the degree in social work by being seconded onto those courses by the local authorities, with a commitment obviously afterwards that they remain working within the local authority that sponsored them for a number of years.
Okay, thanks. Just a final question. Are the the staff, employees, carers, are they asked to identify their own training needs on a sort of regular basis?
Yes, absolutely. So again, I can talk from a social care perspective and a Newport specific perspective. So all of our social workers, and it's expected that they have a formal one-to-one supervision each month, and within that supervision there is discussion about their learning and development needs, and it's that information that is gathered and then shared with our workforce development team, so we can see the needs of the workforce, and there is obviously opportunity for them to develop as individuals through that mechanism.
Okay, so thanks very much. Right, thank you, Chair. Thanks.
Thanks, Councillor Screen. Natasha, did you want to add anything to that, or are you happy just to move on?
I could add from an engagement perspective, if that's okay. We've done, as I say, we've done a lot of engagement with people living with dementia and carers in the Newport area, and there are a lot of needs being highlighted where members of the community are highlighting specific learning and development needs that they have. We're taking that forward through Dementia Board, and we have got a programme that we're looking to get, well, it's just on the verge of sign off, where we'll be able to deliver a training package that will be free to carers and people living in the community and paid professionals. So that covers that sort of area. We're also doing a lot of work around the autism code of practice, where we're working with people that are autistic, their families and carers, to identify what their learning and development needs are. So, Tanya's just covered from a staffing and employment perspective, but we are also doing a lot of work with our community members where we realise that there might be learning and development needs there around care and responsibilities.
Okay, thank you, Chair. Yeah, that's very important. Obviously, the carers as well. Okay, thanks very much. Thank you.
Thanks, Councillor Screen. I've just noticed that the Cabinet members just joined us. Good afternoon, Councillor Lacey. Nice to see you.
Hello. Sorry for my lateness. I just rushed from an appointment.
Oh, no problem. Obviously, we've had the presentation and we just got into questions, but I mean, I don't know whether, as Cabinet member, did you want to make any comments at this stage, or?
No, it's difficult for me. Obviously, I've only recently picked up a portfolio, so I've only attended a couple of meetings with the RPB, but, appreciate all the work that Tanya and Natasha are doing, and the rest of the team as well. I think just one thing to add is that I don't know if it's been mentioned, but as part of the RPB, I've taken on the role of autism champion for the Gwent region. So that's something that I'm doing on top as part of this work as well, which is something to get my teeth into. But I listened to the rest of the questions and I'll nip in if I'm needed. Lovely.
Thanks, Councillor. Right, I think next on our list then was Councillor Marshall. So over to you, Councillor.
Thank you very much, Chair. The first question is, given the numerous programmes there, how does the RPB plan to streamline service delivery to reduce duplication of effort and enhance efficiency across the region?
Okay, so again, if it's all right with you, Chair, if I start and then perhaps Natasha, I'm sure will want to come in here. So the Regional Partnership Board has, you'll be aware that there is a significant amount of grant money that is attributed to the Regional Partnership Board, the Regional Integration Fund, and that fund, as you rightly point out, funds a number of projects, a large number of projects across the region, and absolutely right that we need to make sure that there is not duplication of effort when those programmes are being delivered. So what has come through to the Regional Partnership Board for agreement over the summer is a review of all of those programmes, and all of those programmes have been what we call RAG rated, sort of green, amber, red, for them to be reviewed and looked at, because the Regional Integration Fund, we only have that will only continue until 2027. We have no commitment of that continuing beyond that point. So the Partnership Board is acutely aware that if, for whatever reason, that fund does come to an end, then we have to do some serious prioritisation of the projects that currently exist to see what we feel needs to be continued. Having worked in this space for quite some time, I can tell you that the significant majority of those projects funded by that Regional Integration Fund are very much delivering a number of core services, both across health and social care, and there are real risks attached if that fund were to end, and I'm sure members are cited on that. So to make sure, so in answer to your question about making sure that we streamline and we ensure there's appropriate service delivery, that prioritisation exercise, that review of all those projects is ongoing at the moment, to make sure that that is the case across the region.
Thank you, Chair. I'm not sure if anyone else is going to answer the second part of the question.
Yeah, sorry, Councillor Marshall. I was assuming you were going to have a follow-up question, so I was just waiting for you there.
Sorry, Chair. I do have a question. I thought Tanya said that she was first and someone else was going to answer, so I waited to see if someone else was going to come. Sorry. That's fine.
Yeah, apologies, Councillor Marshall. Nothing to add. Tanya's just covered everything I would have said, so thank you.
Fab. No worries. The tumbleweed moment of who's next. That's no problems. The one I would say concern is out there from a personal perspective, and that's because obviously of experience as a cabinet member formerly with social services and understanding to a degree. It relates to the funding and about how the RIF funding works. So you have the 100%, then it goes down in thirds is the understanding, and then the local authority is due to pay up, for the project long term. I know there's been kind of like ping pong matches, if you will, with funding with the basically the RPB and Welsh Government. I'm just wondering, what is that current relationship looking like moving forward after a number of different things in the past that have had that back and forth, and acknowledgement that Gwent actually did lead the way on a lot of this, because I think a lot of other local authorities hadn't realised the implications in the past of what things might do or happen because of RIF funding and the way it does integrate within the local budgets.
Again, if it's okay with everybody else start, and I'm sure Natasha may want to come in. So I think what I've heard there is I think you might be relating to the tapering element that the Welsh Government agreed that should be implemented at the beginning of this RIF. And you're absolutely right, Councillor Marshall, that Gwent did lead the way in lobbying Welsh Government to say, if you apply the tapering element, then there will be a number of programmes that will be taken down, which will have a significant impact on the people living within the Gwent area. And the Regional Partnership Board, through the chair of the board, wrote to Welsh Government at the time and the relevant ministers, and there's been a change of ministers since, about the impact, and requesting that Welsh Government removed that tapering element, so the Regional Integration Fund remained the same over the lifespan of the grant, and that did actually occur. So the tapering element has been removed, and there is nothing currently coming from Welsh Government to say that is going to be reintroduced during the lifespan of this grant, which will take us up to 2027. So it was worth all of that ping-ponging back and forth between the region and Welsh Government, because we did reach a place that we felt was the right place for us as a region, and absolutely nationally as well. Natasha, I don't know if you've got anything to add to that.
No, the only thing I would add is regarding the grant funding and the risks attached to it, if it's taken down post 2027, or we don't know what that's going to look like. The RPB chair and Leeds across Wales are consistently raising that issue with Welsh Government, so that we can sort of try and find out what's going to happen with this funding sort of sooner rather than later, so we can start planning ahead for Gwent. So just to add that last bit. Thank you.
No, I appreciate that, and hopefully, you know, we won't be in the same position, because obviously we don't like conflict with different levels of government. We want to be working together for the benefit of our residents overall, and I think that is vital. The next question from reading the report is, how will the RPB ensure the sustainability of critical services, such as like bereavement support and other limited, so time-limited initiatives that were dependent on short-term funding?
Okay. Natasha, do you want to start with this and then I'll come in? Can you hear me?
Yeah, sorry, I couldn't get off mute again. Yeah, we're constantly working in collaboration across Health Board, local authority and third sector to ensure that we can sustain some services. I mean, it's challenging times ahead, isn't it, with the budgets that we've been set and the funding that we've been given. But there's a lot of work going on across different areas where we can look at sort of sharing resources. I know from a perspective around the autism agenda, we were looking at sharing sort of rooms that we might be able to use for assessment and diagnosis and things like that. So we're trying to work in collaboration and trying to be quite innovative of what we're doing around sharing resources. I mean, it's a challenge, isn't it? Because we just need to work together at the moment with the money that we've got. So there's quite a huge piece of work going on both nationally and locally around bereavement. And I know that's being headed up by an Iron Bevan Health Board, and they're doing quite a lot of engagement around that at the moment to see where the gaps are in services and to see what we need as a region. So I can come back to you, Councillor Marshall, if that's okay, around the bereavement sort of query that you've got, once I know a little bit more about what the national sort of solution is going to look like and what it's going to look like on a local level.
So yeah, that'd be brilliant on that side, and thank you very much. Obviously, it's important services for residents to make sure that we do keep in some way, shape or form to make sure that they can fully access it at that time of vital need. I think the next kind of area of focus for me, and it has been for a long while, even as cabinet member and now backbencher, in relation to the workforce shortages, and about what steps are being done as a RPB in order to look at addressing some of those. Like, I know some of those have been looking at the agency staff and limits and things like that, then about timeframes and when they can come to work for the authority. I think 6 months post leaving a local authority to be able to work as agency staff in one of our places or residences in that regard. So it's just, if there's any statement or anything that you can mention about what the RPB is doing on a more regional basis. Thank you.
Okay. Again, maybe if I start and then maybe Natasha might want to come in. But the workforce shortages will be certainly a topic of conversation that in that workforce development board that I mentioned earlier in the meeting. And it's something that both health and social care have struggled with. I don't need to tell you that. I think that there is some partnership work, and again, I am going to look to Natasha around this, but there is some partnership work being undertaken with the universities to bring in, and I am going to look to you, Natasha, because the detail of this is not springing to my mind, and I hope it's in the front of yours.
Yeah.
Yes.
No problem. Do you want me to come in? Is that okay?
Yes, please,
yeah. So we've got a workforce and college consortium programme that's going from strength to strength in Gwent. So we've got a regional work placement scheme, and it was launched in sort of around the end of 2022, I think, and it looked to support students to apply for local authority work placements, and also to support sort of work across social care teams to try and get more people into the health and social care space. I know that there was around 100 work placement applications received for 23-24 within that particular academic year, and I know that the RPB are continuously engaging with members of Coleg Gwent and also University of South Wales to try and promote careers across health and social care, to really help people sort of access courses and support if they need to. Similarly as well, there was a clinical placement programme that we worked with the Royal Gwent, Neville Hall and Ysbyty Ystrad Fawr to look at sort of how can we progress sort of second year students within clinical placements. We've also got sort of programs around access to medicine courses, because there's been a continued shortage of sort of Welsh students seeking to pursue a career in medicine. So we've been looking at sort of particularly students from socially disadvantaged areas to try and get onto those courses so they get the opportunity to do it. So there's lots and lots of work progressing in that area across both health and social care, just to try and sort of capture people early before they go into the workplace and leave university. And I know that a few years back, we also developed a book that was read out in sort of primary schools to sort of just to sort of get the interest of young people in, nursing and social work care and that sort of thing. So there's plenty going on in that space, and we're constantly building on that work, because there's always something that we can be doing to improve that. But I can keep you posted on the work around the college consortium and any work to do with the placements and things.
I think that'd be great. And through the chair, thank you. I think it's just important as well because when again, from previous experiences, trying to avoid that previous experience to a point, but obviously with the knowledge base, the workload of these social workers, including safeguarding areas that we, are vital to make sure that these children and other vulnerable adults are safe. We need to make sure that we do have the staffing in there. And I know in others, with the creativity and initiatives to have a look and seen, rather than being a general worker, what can we do to make the teams more interesting in order to engage more people to go into specific functions, things like that there, which has also been really good and really promising in moving forward. So it's just a comment in relation to that as such on that side. I will change the scope a little bit on that side. It's just basically looking how is the effectiveness and initiatives such as the dementia-friendly Gwent network being measured, and what indicators are being used to evaluate the impact on the ground? And I know there's things like the Newport Dementia Hub and things like that, they're being triggered on a more local basis, but just to hear what's happening on a more regional basis, please.
And I'll let Natalie, because this is her baby, I'll let Natalie speak to this.
No problem at all. Yeah, sorry, I'm having a few problems with my mic button. We've been running the dementia friendly community scheme now for over 7 years, and we've sort of reached thousands and thousands of people in the community. It's building from strength to strength. We've currently got a dementia friendly Gwent network with over 300 plus members, and it's a multi-agency partnership through local authority, health board and third sector. We've also got people living with dementia and carers that sit on that partnership. So if we get any consultations or any work that we're doing around the dementia agenda, everything's fed through that partnership, so we can make sure that we're doing, even down to posters and things that we're promoting in the communities. We want to make sure that we're getting the messaging right, and that it goes through people living with dementia first to make sure that they're happy with that. Now, the dementia hubs, we're just starting the development of those, sorry. We'll be setting up a dementia hub in the Riverfront Theatre in Newport. That's going to be towards the end of November, December. We've been working very closely with the CEO, and he's very excited to house the hub there, because we're looking at sort of you know, not only supporting people living with dementia and their carers, but we're also looking at it from a prevention type point of view, because we're aware that up to 40% of dementias are preventable. So we're looking to raise awareness of the 14 risk factors of dementia in Newport and really get that message out there that if people, you know, to get your health checked, your cholesterol levels checked, all those sort of things, and dietary information, so that we can really reach out and get that information out there through a prevention lens. Regarding the question around the effectiveness of Dementia Friends, it's been incredible. I've delivered thousands of these sessions in the communities, and we always get people coming up to us after we've delivered the session to say, well, I'm a carer, that's really helped, I didn't know that, and that's going to really affect how I care for my loved one. We've also had people living with dementia that have sat and had the session and they found it really useful, and I've also delivered the session with a person living with dementia, and that was really good, because it meant that we could go around to different organisations together. And she was not shy in telling the organisation what they were doing that wasn't dementia friendly, and what was really helping her as a person living with dementia, but also what was supportive for her family and carers. So there's a lot of work going on in this space, and we're really grateful to our, you know, all the partners in Newport for engaging with us, and you know, there's still a lot of engagement going on. I think we've ran over 100 sessions to date, working with the communities to find out what dementia care looks like in the Newport area. And we've also run hundreds of sessions in Newport on, you know, delivering Dementia Friends, including to the huge Tesco in Newport Spitty Park. A lot of the staff that are working in there are dementia friendly. So I could talk about this all day, Councillor Marshall. So I don't know if I've answered your question, sorry, because I'm really passionate about this. So if there's anything you want me to clarify or go through even further on that, I'm happy to do so.
No, it'd be good. And I would ask that maybe you keep us updated with any progress moving forward. I think that would be really good to see how that partnership is working. But hopefully for us to be able to maybe see and things like that as it moves across, because more and more it is something that we are seeing in our communities and things like that. So it'd be ideal for us to have that knowledge, you know, what's happening essentially. And it's not just us in the committee. I think overall would be quite beneficial in that regard. And I know there is like the various newsletters and things that come out and stuff, and, you know, from community connectors and others with news, but just anything you think that we need to be aware of or could even help advertise, please do keep us in the loop within that regard. I think another kind of thing that I was looking at, you know, again within the previous role, is about how, you know, maybe the partnership could be challenging itself and the local authorities and the health board about how we communicate, but also how people access services. Because sometimes, for example, if someone or a carer was to try and get hold of someone within a council to do council tax or, you know, issues or whatever it is, sometimes the language, the accessibility can be really quite difficult in order to get through. And just wondering, have that been, you know, noted in any way in that partnership working? And is there any things that you're doing collectively to maybe looking at addressing those, working together, finding out what those issues are of access points, and about how we can, you know, make that better, how we can be more accessible for those that need it? Thank you.
Natasha, do you want to start and I'll come in?
Yeah, no problem at all. Yeah, so regarding accessibility, again, that's a huge passion of mine. We work very closely with the strategic partnerships that we've got in place that sit under the RPB. We currently have, under the Mental Health and Learning Disability Strategic Partnership, we have several members that are either living with poor mental health or they're living with a learning disability. So they're very good at helping us to ensure that we are accessible in what we're doing, you know, that our reports are in an accessible format for them to be able to actively participate at board meetings, because we're very clear we don't want it to be tokenistic. We want people to feel that they are included and they are an equal partner in any decisions and discussions that we have. So we've got induction processes that are being developed to help support community members to be part of our strategic partnerships from an accessible perspective. We've also got a regional partnership board website that is currently undergoing sort of a new design, and accessibility is a key part of that. So we've now developed the website. It has a reading age of 12 now, which is the national average age for reading. So we want people to be able to read what we're doing as a partnership and provide feedback. So we're sort of overhauling the whole website to ensure that it's accessible to all. We're having a run through at the moment through our documents to make sure that they're an easy read format, so that, you know, when we're working with people that need reports written in that way, we're making sure that we're doing that so that we can make have that engagement with people. So we're constantly learning. We're not quite there yet. We're still doing, you know, there's still lots of work ongoing, but we're very aware that we want to be an accessible RPB, and we're doing everything we can in our power to sort of change how we do things.
That's great. I appreciate that. And it's something, again, to make sure that even as a council side, like even for the reports for this meeting and others across the board, it's a very long report. There's no summaries. There's no kind of thing to be able to help those that may want to kind of dip in and look at it without the knowledge base of coming in and understanding some of the technicalities that go behind the main report itself. So it might be something for us collectively to look at and about how we approach things, and maybe a point through the chair that we can maybe have a look at and how we deal with that. Because, like, I know the Welsh Government, for example, and the Welsh Assembly, the Welsh Parliament have also done a lot of things for years about the summary document and then the full reports to make sure that we're as open as possible to community members, but also to make sure that it is, as you said, easy enough to read on different platforms in that regard as well, which will be vital for if we want people to engage with us and to have access to us to understand what's going on. We need to make sure that we can relate with them and in the way that obviously they can understand and be approached. Chair, I've got two more questions in that regard. The one kind of piggybacks off just something that you've actually said about the digital platforms as well, and that's just basically about how you plan to evaluate the long term of effectiveness of the digital platforms. Like I believe Sarah is one of them, improving access to care for those that are digitally excluded, especially within that, please.
Are you happy for me to start again, Chair and Tanya? Yeah, okay. Yeah, we do a lot of work. We're currently working with Data Cymru for our digital platform because they host our regional partnership or website. So we're working very closely with the digital leads, and we get data collected every time somebody accesses different pages of the regional partnership or website, so we can see which pages are most frequently visited, you know, where we might need to make changes and that sort of thing. And a lot of the community engagement work that we do, we tend to offer people paper formats to engage with us, but we also have QR codes to link through the regional partnership or website. So again, we can then track the data when people are accessing those sites. Regarding Ask Zara, it's exactly the same. We've got tracking in place for that. So we collect all the data when people visit the site, when they download reports, that sort of thing. And we do provide quarterly updates to the Regional Integration Fund around that, because that particular programme of work is currently funded for a 12-month period under the Regional Integration Fund. So we have to provide quarterly updates on that. I think I might have I answered that question, Councillor Marshall, or would you like me to continue?
Sorry, there's just a little bit more about those that are maybe digitally excluded. I know you said about the papers, but it's also about, you know, sometimes we see you at events and stuff engaging with the communities, but sometimes people don't know about those events because a lot of the things that we do now is heavily publicised online. So it's just about how we get to those more socially disadvantaged groups, or those that might be not digitally literate in that regard.
Yeah, thank you. I knew I'd missed something. Sorry about that, Councillor Marshall. So yeah, we often do leaflet drops as well. So we work very closely with GP surgeries. So when we're running programmes such as Ask Zara, or any other programmes that could be accessed by the community, we tend to focus on GPs are great because they allow us to host the leaflets within the surgeries. We also do leaflet drops to communities. There's a lot of community boards that we tend to promote things on, and that's going to be a key part of the dementia hubs going forward. We've got a community board with third sector partners, health board and local authority programs that support people living with dementia, families and carers. Will be able to not only advertise through our website or any sort of digital platforms, you know, social media and things like that, but we'll also have the posters that we'll be able to sort of put up on the pin boards to allow people to have access to the information.
That's great, thank you. And I think, if possible, use us, as said earlier. So as councillors in our communities, we have access to our various groups and things like that there. We talk to different people, but also if there is posters and things like that there, we're able to link with our local shops and things like that there in order to get them in. So it might be a bit more about how we can be better working together collectively and how we get that out, because people should be accessing this quite rightly and have knowledge of this. If it's not them, it's for a family member that might be of need, isn't it? So like things like, with school bulletins, is there someone in your family that might need the support, or do you need support because someone in your family is A, B, and C and things like that there? So to make sure that we do have an all approach, to collect all kind of thing as much as we can. But it's fantastic from what you've said that, there is a lot of work being undertaken within the partnership already, addressing GP surgeries and leaflet drops and things like that there. So there is good effort. But, I'm going to say it's never perfect, but please do use us and things like that there to help you on that journey to be as best as we can be collectively in that regard. The last one is going to it's the question of all questions, because obviously we like to say our winter pressures all the time. We're going into another winter pressure. We have winter pressures every year, and I know this is something that obviously is questioned every year in relation to the partnership as well. So the question is, how does the increasing pressure on hospitals affect community care and leisure services, which are essential for preventing hospital admissions? And should a larger proportion of funding may be allocated for like more council-based, community-based projects rather than relying on short-term projects? Or how do we, it's kind of that, how do we improve to make sure that we never have to say winter pressures? But that's probably the million-dollar question to that regard. But it's just seeing whether ways, how we could be that little bit more different in how we keep people at home more. Because there's a thing, isn't there? If people go into hospital, they're more likely to get worse rather than better in some regards, and they get better quicker and easier at home because they're in a surrounding that they are well aware of, and they feel more comfortable and more at ease.
Okay, thanks. If you don't mind, I start with this, and certainly Natasha can come in afterwards. And that's a huge question, and you recognise that, Councillor Marshall, absolutely. And it's definitely something as a regional partnership board that we are constantly grappling with. Earlier this year we had a few workshops around exactly that, and recognising that we need to think more into the longer term and about prevention, to prevent people from having to be admitted to hospital in the first place. And people's lives are so multifaceted, and there's so many things that impact on people's health. This is a very challenging area to get to grips with. However, we absolutely recognise as a regional partnership board that we need to get into that prevention space. And of course, winter pressures, if you talk to the heads of adult social services, they'll say they're not just here in winter, they're here now all year round. The pressures on the hospital, are all year round, not just in the winter time. And so there is a temptation to simply focus on those pressures instead of looking further downstream about how you can prevent those from happening in the first place. So we've certainly started those discussions, and a lot of the programmes that are funded by the Regional Integration Fund are in that space. They do look at improving, preventing people from getting into hospital. And I'll give you a quick example of that, a Newport example, if I may. So early this week, I went to visit Parklands, which is one of our residential homes in Malpas. And they have the Regional Integration Fund are funding a number of bed spaces in Malpas in two respects, really. One, to support people for early discharge from hospital, so they're not blocking valuable hospital beds, and they can undertake that rehabilitation within the home and then go home. But also the other way around. So instead of going into hospital, if people need a bit of extra help and reablement to remain help them support living in their home. They might come into parklands for a short space of time and then improve their health and well-being and mobility, whatever the issue might be, and then go back home. So there is a lot of work being done in that space. Can we do more? Absolutely. And I think the review of the programmes that I talked about at the beginning of the meeting, all of those programmes that are being funded via the Regional Integration Fund, I think that review will help bring into sharp focus how many of them are focused on the preventative side and how many on the acute side. And there is an absolute willingness from the board to shift that balance and our focus to prevention rather than to the acute.
That's great, thank you. And it's one of the things that obviously I don't know the figures on that, so I'm not going to quote the figures, but I know for like every pound spent on a more local authority based, the NHS makes a lot of savings in terms of budgets because of that. So again, I don't know the figures, but it's a big saving. I understand that and get that, and I think that's important to remember. You know, within the partnership, that we are doing a good service, and you know, with that preventative work, we can actually save the NHS a lot of money in that regard. So you know, hopefully with that knowledge and base, that they would support us a lot more through resources and funding, because I know in the past, hopefully the partnership is getting better all the time. It's just more that I know in the past there has been challenges of, you know, you pay for it, no, it's your payment, and things like that then back and forth. And there is in other parts of the social services sphere of things, I know there's arguments about who's relevant for which. So it's nice to see, you know, that collection of work going together. And it leads me to think on a comment, I think it was Ellen Ed Morgan when she was still on the Health Secretary rather than First Minister. There's a policy, isn't it? It's like working together more. So the NHS and looking at the preventative care, things like that there, and what care can we do in the community a lot more rather than this back and fro. How can we actually do it together? What's needed in our communities, and a more community-based approach to kind of go in and making sure that our residents are getting the best care possible. As said, you know, within their homes and communities, rather than having to go to hospitals, which can at times make them a lot worse than what they are, and you know, sadly deteriorate in comparison to what they would do, you know, within their own house. And thank you very much. And that's me, Chair. Thank you.
Thank you, Councillor Marshall. I was going to say that a bit quicker, but I couldn't get my camera to turn on. But no, thank you for that. I mean, I've got Councillor Bright as the next one on my list, but if you don't mind, Councillor Bright, I've got a couple of comments myself that sort of follow on from what Councillor Marshall just said. So it seems like a good time to just mention this. Sorry, I'm trying to switch screens here and I get myself in a bit of a mess. No, one of the points that Councillor Marshall made was the use of community groups, and it's funny because I had this conversation yesterday with some councillors. There's been a couple of events lately. That there was the Let's Connect Newport, the 50+ events in Newport as well over the weekend, and it's a theme that seems to be coming up quite a lot in various areas where there's lots of things available, lots of help, advice, supports available, but then it's getting that message out so that people are actually aware of it. And I think community groups are a massively underused resource. So I could just think of some community groups in my own ward where you could reach a lot of people very quickly just by going through those groups. So I just wonder whether maybe the community connectors might be, I know you work with the community connectors anyway, but would they be a sort of a good resource to make that connection and reach those people?
Yeah, certainly, you're absolutely right. You know, that we have community connectors in Newport, based in our front door teams, if you like, of social services, and I think there is definitely more work to be done. And I agree. We need to be harnessing more of these community groups and the work that they do, because in reality, there is a finite resource, isn't there, both from a local authority perspective and a health perspective. And I think we often are not harnessing the community groups to maybe fill that gap in some respects. And certainly as a conduit and passing information out into into the public domain with people in their communities, that's something we can absolutely look at. And I think we need to be probably taking that conversation back into the Regional Partnership Board, and certainly something I'll be looking at in more detail here in Newport, about how we can maximise the role of the community connectors into those community groups.
Yeah, but I'm just thinking of one group in particular that I run in Rogerstone. I mean, there's about 30 members in there, but two of those members themselves run another community group elsewhere in Rogerstone. So at a stroke, you could probably reach around about 100 people with one message just via those people. So that's just an example, but yeah. The other thing I just wanted to quickly ask as well, again, I'm flicking screen to try and find my notes, and I need to get these notes much more organised. But I guess it is coming around to awareness of things like the community car scheme, befriending services that obviously you mentioned in the report. So would you say that those sorts of services are taken up as much as you'd like them to be? I'm thinking in particular of the befriending services and the community car scheme.
Natasha, do you want to come in on that?
Yeah, no problem. Yeah, they're actually used very well. I think they don't quote me on the dates, but last year they received more funding for the community car scheme because it's so popular, it's so well used, and I know other areas have been looking at the potential of maybe taking that same model and using it in their area, because we know that we know that transport is an issue across Gwent. Previously it was felt to be an issue with it just in sort of rural areas, but we now know that a lot of people struggle with transportation to get to activities or hospital appointments or whatever it might be. So that sort of scheme works really well because it allows people to have that reliable transport, but from a safe place as well. So that they are looking at adapting that model and adopting it across other areas. So yeah, very well used. I mean, there is more that we can always do, as you said, Councillor Reynolds, around sort of using community groups to make sure that we're promoted and things like that. And that's something that we're always looking around our comms and engagement work within the Regional Partnership Board to see how we can do things more effectively to reach more people. So we'll definitely take that on board.
All right, thanks. My last question, again, this is on the back of something that Councillor Marshall raised. You mentioned a bit earlier on about the dementia-friendly organisations within Newport, and obviously the report says that it highlights that Newport is been highlighted as a key area. I mean, I certainly wasn't aware until you mentioned it about the preventability aspect of dementia and the fact that 40% of them are potentially preventable just through lifestyle choices, which is just incredible, really. But with Newport having the highest diagnosis level in Gwent, apparently, I just wondered whether you've got any information on whether that's because Newport is particularly good at diagnosing, or is there a reason why people or more people are getting symptoms of dementia in Newport? And then I also on the back of that, I just wanted to ask about the RIF funding, because you've mentioned that there's a short-term element to that. How does that impact on your long-term planning? With things like dementia, it's not an overnight solution, is it? You can't. There's no short-term solutions for this. So with the short-term aspect of the funding, how does that impact then on your long-term planning?
Tanya, do you want me to take the first
Yes,
question
please,
first?
yeah.
Yeah, no problem. I mean, I know I've spoken to you about this the other day, Councillor Reynolds, and this is a
Yeah.
really challenging one because
I
we
know we
haven't got
spoke it privately, but I thought I just wanted to bring it up in the public forum.
No, absolutely, and I completely understand that, and I wish I had a definitive answer for you, but unfortunately, that we haven't got the data that would show us, why we're getting more cases through. I mean, it could be a mix of awareness raising and more people are actually going to their GP and getting that sort of initial sort of assessment diagnosis, but there could be a range of things behind that, and I have asked the question and I haven't got an answer for you, I'm afraid. But we are I think when I spoke to the Alzheimer's Society a few months back, Monmouthshire have now sort of slightly overtaken, so Monmouthshire have the highest rate of dementia diagnosis. But I know that sort of with the you talked about the sort of preventative model that we're trying that we want to use going forward around the dementia hubs, and it is, 40% of cases are preventable, and that's why we want to sort of support that community awareness raising and the actual training around that, because we've got dementia leads at the moment that are just finalising a brain health programme, and that's something that we'd like to roll out within the Newport Dementia Hub for anybody to access, which we will heavily promote through. And now you've all offered to promote that. I hope you don't mind. I'll be sending you the information through for that, so that we can get as many people as possible to attend that and get that message out there. I'll hand over to Tanya to look at to answer the other question, if that's okay.
Thanks, Natasha.
Yeah, so in relation to, it's a really good question about the RIF funding and short-term planning, because the RIF funding is short-term, so it does have an impact. So the hub that Natasha has referenced a number of times during this meeting has been a part of short-term funding bid, and I'm correct in saying that, Natasha, aren't I? So we will look to do a lot of work through that hub to raise awareness, provide information to the people of Newport about how they can avoid, having avoidable dementia then. But it will have, there will be an impact if that funding is then ceases. And unfortunately, that's not just the case with this particular issue. This will be the case in relation to other issues. All of the work that's highlighted, a lot of the work that's highlighted in this annual report is very much dependent on that short-term funding. So there is still, I think, sort of lobbying to be had potentially with Welsh Government about bringing this funding on a more permanent basis to deal with those short-term funding issues.
Yeah, thanks. As you say, I think it's a regularly recurring theme, isn't it? That I used to work for Communities First, and we had very similar issues there, where you try to set up projects for communities. You can't turn around communities in a couple of months, but the funding, it's done on a quarterly basis, or it was done on a quarterly basis. So yeah, that's why I raised the issue, because I just know how it affects your planning. But yeah, thanks very much. I'll hand over to Councillor Blight now. I think you're next.
I'm here, just trying to turn my camera on. There we go. Thank you, Chair. Well, first of all, thank you very much. There's lots to commend in this report. There's really lots of good stuff going on, from the the space program, the Gwent Connect 5, and as has been mentioned, the success of the dementia programs. It's really, really encouraging. And I know that I wasn't part of the committee last time, and the committee mentioned about the length of the report and the complexity of the report, which Councillor Marshall mentioned on. And I just noticed this report is actually shorter than last time, so there's a step in the right direction. I think it was 81 pages last time. This is 50 pages. But what I wanted to pick up on is the work you're doing and how we're monitoring how well that is in relation to carers. There's lots of good projects going on to improve the well-being of carers. Just how are we measuring that that's actually working? That people's well-being is actually improving. How are we measuring that? Thank you.
Okay, Natasha, do you want to start with that?
Yeah, no problem at all. Okay, so we've got a carer strategic partnership that is led by one of the directors of social care, and that's a multi-agency partnership across Health Board, Local Authority, Third Sector. We've also got carer representation on that board, so they feed in a lot of the work that's going on in our communities, and we've also got subgroups that sit under that have unpaid carers around the table to sort of give us feedback on what's working well, what isn't working quite so well, where there are gaps in provision. So we're always working to improve things, but there's a lot of work going on in the carer space. We've got hospital discharge programs in place at the moment. They, as we were just talking, they are regional integration. They're funded through the Regional Integration Fund. There's a pilot going on at the moment that's working with hospitals, and we've got carers hubs set up within the hospitals to sort of support carers through the discharge process. I know there's a lot of work going on around employment, so working with employers and around sort of their policies that they have in place, so we can make sure that carers are supported in the workplace. And we've got a carers accreditation programme that's linked to that. We've also got a lot of work going on within schools with young carers programmes, where we provide sort of respite options for young carers, where they can go out and have an activity for a day and things like that. So there's lots of work going on, and all that work is tracked through the Carers Strategic Partnership. So there's reports done on each of these different sort of activity areas, and that's fed through to the Carers Strategic Partnership and then through the Regional Partnership Board.
Yeah, Diolch, thank you for that.
Thank you, Councillor Bright. Have you got any other questions, or?
No, they've been mopped up by the previously asked. Thank you.
Okay, no problem. Thanks very much. Councillor Marshall, I can see you've got your hand up.
Yeah, thank you. It's just basically in relation to the answer that just was. Sorry, my screen's gone a bit funny there. There with. Oh, there it is. There we go. I don't know what happened there. Sorry about that. So it's just from the answer that was given there, basically about the carer accreditation. It was something formerly as a cabinet member I was interested about doing a young carers accreditation as well. But I'm just wondering, potentially on both, is there ways to tell us within the, whether or not it's like as a city or by ward basis, who is actually accredited in our areas, and about how to move forward with other new ones? Because I have to say that that's news to me on that regard. But I'd like to try and promote it to get more where we can, because it is a vital thing that we need to be open to. And the service that they provide for what they do to family or friends and things like that is absolutely phenomenal, and we need to make sure that we have their backs essentially. So if that could be done, with that would be massively appreciated. Thank you.
No problem, Councillor Marshall. I'll pick that up. I've just put it down as an action to look at that for you. That's
brilliant. Thank you. Thanks, Chair.
Thanks, Councillor Marshall. Councillor Whitehead, sorry, I didn't see your hand up. Apologies.
Yeah, no problem, Chair. Basically, a lot of the points for my notes I brought have been raised. I mean, Steve Marshall, fair play to you. You'd never have thought he was a cabinet member. I was going to talk about the positivity of the DOE clicks that have gone up, as opposed for those without access to the internet. A lot of that has been covered. The leaflets in the local hubs, I feel, has been covered. I put bullet points to condense quite a chubby report, so to speak. They would be most helpful, so you can condense it down for us, our simple souls. It is quite a lot to get your head around. It is a comprehensive report. And also the fact that we can share as councillors, some of us at liberty to do that, and often do with other people that we're involved with in other groups. And I wanted to pick up on like the bed blocking type of issues, just on a personal note. That we noticed our own mother-in-law, 81, we felt she was kind of bed blocking, and she was worsening whilst in hospital, which has also been mentioned. We actually signed a disclaimer, brought her home, and she thrived. That can and does happen. So there's another valid point about people being they feel more comfortable in their normal home, and that works. That actually literally works. And the other one, I suppose, was around I think it was Councillor Screen mentioned earlier on about training and different sorts of training, and I was just wondering about, like, we operate where I work, we have a training database. Coordinator sits above that database, and the aim of that is, instead of like mass training, sometimes they identify people because they have already their skills within that database, and the needs for training, and we have this coordinator that he identifies, rather than spend lots of money group training and having lots of people train, where it's relevant and required is what they identify, and that maybe is something to also look at.
Thank you, Councillor Whitehead. Yeah, I think certainly from a training perspective, again, I'll bring it back to the Newport local authority perspective. That identification of training where it's needed, and as I said earlier on in the meeting, using our more experienced staff to provide training. It doesn't have to be commissioned from an external body. I think that training, we maximise the knowledge and experience that we have within the workforce to make sure that the whole of the workforce is at the same level. So there are processes in place that will enable that to happen on a team by team basis.
Okay. Is it also like mentoring? Does that happen? Is that a reality that goes on?
100%. So we have in each of the, certainly I can talk very much about the social work teams, and within the teams we have a team manager and what we call the senior practitioner, and part of the role of that senior practitioner is absolutely to mentor the less experienced social workers, to accompany them on difficult areas of practice, and also to mirror good practice, so less experienced social workers can learn from them. So that definitely those things are in place.
Okay, thanks for that. And just to say, I think like everybody else will be in agreement. You guys are massively valued. It's a difficult area, an emotional area. And I just say, keep up the great work. Fantastic.
Thanks, Councillor White. Yes, I think we'll all echo that. Councillor Hussain, I will come to you in a second, I promise. I can see Councillor Marshall's got his hand up. I'm assuming this is related to the current question or the current discussion.
Yeah, it's just in relation to something that Councillor Whitehead just noted, actually. It just rang a bell to what was said to me on the weekend, actually, by a resident, and I thought it fruitful to note. It's just basically they had cellulitis, went into A&E department and was in there for a number of hours. But when they had the discussion with the consultants and things like that within the hospital, they actually asked whether or not they could go home rather than just waiting around in the A&E department. And it was agreed that the fact that the district nurses would go out to them. So it's just a question whether or not maybe can A&E itself look at ways of maybe how they can discharge effectively rather than making people wait. Is there other ways and routes that can stop them from going into A&E, or when they're there, if they can be discharged a bit quicker rather than having to wait to see someone? Is there ways to signpost more effectively? I know there's a bit of duty of care there in some regard, but is that a way that we just can be looked at potentially? Thank you.
Yeah, just in response to that, I know that there is a lot of work that's going on between the health board and social care professionals on exactly that, about how waits can be minimised within the A&E department, and that people attending the A&E department can be redirected as and when appropriate. So there is a lot of there's a number of regional meetings that have been called to look at exactly that issue, Councillor Marshall. Is that not being cracked? Absolutely not. Is it being discussed and and solutions being thought about? Yes, absolutely.
That's great and really positive, and I thank you again for the rest of that, and hopefully I won't trigger. As I said, my mind is like a guinea pig on a wheel, so it's always on the go there. Thank you.
Thanks, Councillor Marshall. That's a mental image I'm gonna struggle to get rid of today. Councillor Hussain, I think you're next.
Thank you, Chair. Yeah, so I wanted to actually ask about raising public awareness. There is a little section on there, not really much, but being from the diverse community myself, I mean, I'm not sure if you're aware, dementia and mental health conditions are a bit of, taboo within the diverse community, and families don't want to talk about it. So with regards to raising public awareness about services that are available through the partnership board, obviously is essential, particularly, from underrepresented populations who may not be fully aware of available resources. I was just thinking that what kind of strategies or structures have you got in place? For example, do you use social media campaigns, informational workshops with local communities, local organisations, partnerships, and collaborations with advocacy groups? which can, always enhance visibility. Have you got like a tailored message for which is culturally relevant for engaging with marginalised communities?
Thank you, Councillor Hussain. And again, I'll start with this, and Natasha may well want to come in. So one of the things, and you'll see within the report, there is a structure chart of the regional partnership boards, the regional partnerships that sit underneath that, and then within each local authority there is a local authority partnership board, and I'm very early into sitting on that board within Newport, and in fact we had a meeting only last week, and what I heard around that table in relation to what was going on in Newport, so there are a couple of what we call NCN, so neighbourhood care networks within Newport, and they are overseen by GPs. So, and I heard that exactly that issue was raised about how we reach our ethnically diverse population within Newport, because they won't necessarily always come forward through normal channels. And absolutely right that a number of these issues wouldn't be routinely talked about, within those communities. And what I heard was that there was a number of sessions that were held, particularly within the Pill area in Newport, in partnership with local mosques, and actually going into those areas and going in with information for those in an environment where they felt comfortable. And so I can say it is, forgive me, because I'm 8 weeks into the working in Newport, so still absolutely finding out about how some of the services are being delivered. But I felt that was a really good example about taking the message to the community, as opposed to expecting the community to come to those areas and institutions where they may feel very uncomfortable. So I hope that sort of reassures you to some degree about the thinking that is going on about the need to engage with those those other diverse sections of our population.
Yeah, I think I know what you're talking about. The sessions or the events that have been held in local mosques. There has been there's one in my ward, in Victoria Ward, and I know the one in Pill. I think you're talking about with the Muslim Doctors Cymru. I know they've had a few events in some of the local mosques. I've attended a couple as well. I know Kid Care for You are doing, I don't know if you're actually collaborating with these organizations or the local mosques as well, but these are actually independent, organizations. I mean, they get funding and so forth, but I know there's one mental health nurse that works for Kids Care for You, and she provides services, in their offices, and she does like support breathing techniques, mental health. She speaks, does therapy as well, and that's with the NHS. I don't know if you Afia Begum, I think her name is, but she's the only, those are the only few things that I've actually ever heard of that are taking place. I don't know if you're actually collaborating with them or if you're in partnerships with those organisations. If you can elaborate a bit on that.
Yeah, well, certainly what I heard at this meeting, the partnership meeting, the Newport partnership meeting last week, that there is absolutely collaboration going on with those organisations, and our local GPs and health board were a part of those sessions, and staff from the health board actually attended those sessions as well.
Okay, yeah, well, that's good to know. I mean, as long as something is happening to bring this into the forefront, that's all I wanted to really know, and it seems like it is. Thank you.
Yeah.
Councillor Hussain, do you want me to just add to that around, because you asked about dementia? We've got a dementia programme manager called Sonia Foley, and she's actually working across Newport at the moment, and she is working with a lot of diverse community groups to see how she can sort of explain dementia and sort of just get in with families and the communities to really get that message through around sort of early awareness and support for dementia. So I'm happy to link with you outside of this meeting if you want to know more about that piece of work, and I can actually tell you who she's been engaged with, because that piece of work has been ongoing now for quite some time. So happy to give you more on that.
Of course. Yeah, I'm more than happy to get in touch with you about that. Thank you. Thank you, Chair.
Thanks, Councillor Hussain. That's a really good point, actually, about different methods of reaching different communities. It is really important. I've just got one question myself to ask, if that's okay. There was one, it might be a really unfair question to ask as well, actually. I don't know. I've forgotten what page it was on, but there was a phrase that just caught my attention. And it was about the Autism and Neurodivergence Strategic Partnership. That's a mouthful, isn't it? And it said it's under review. And I just wondered, are you able to elaborate on that a little bit more in terms of, is there sort of an expected direction of travel for that partnership? I'm not really sure how to phrase it, but I'm just wondering where that review may be taking that particular partnership.
That's okay, Councillor Reynolds, if I just provide a bit of clarity on that. So the partnership, it was previously an autism steering group. So we had the evaluation of the autism code of practice being fed through that group, and we were feeding back to Welsh Government on the implementation in Gwent for that. But what happened is the programme has got that big, it is no longer a steering group. And with the Neurodevelopmental Improvement Fund coming into place through Welsh Government, they now have oversight of that funding as well. So it became apparent that the group was getting really big, and it was no longer it was sort of outgrowing the steering group status. So it has now become a strategic partnership in its own right. So it's now an autism and ND strategic partnership. So the reason that it was under review was just to be sort of transparent, really, and let people know that the membership is under review and the sort of terms of reference is under review for that strategic partnership, because we just want to get the right people around the table to make sure that we're doing the best for our community members that are autistic and their families and carers. And it now has the sort of neurodivergence umbrella as well. So we're now supporting people that have ADHD diagnosis or are going through that process. So I hope I've clarified that. So the review is very much just around sort of the strategic nature of the group, if you like. So the sort of remit is that they are there to support and raise awareness around autism and neurodivergence, but they're also there to review the implementation of the autism code of practice, and when the new neurodivergence code of practice comes into play, that will also be fed through that group. So they've got quite a large agenda now. But I'm happy to catch up with you outside of this meeting if you wanted to know more in-depth detail around that.
Right, thanks. I may well take you up on that, actually. I mean, as you say, the numbers are increasing massively, aren't they, in terms of diagnosis? And I suspect, going back to what we said earlier about the dementia, my suspicion is that the numbers are so high because awareness is become, it's been improved, hasn't it? It's people are much more aware now of what to look for, and maybe referring people on. I'd love to find some evidence for that. That's just my suspicion, but it's the same with neurodivergence. I think people are so much more aware now. It's being diagnosed so much better. I'm just going to pause just for a moment. Has anybody else got any other questions? I've gone around the screen. I don't think I've missed anybody. Nope. Councillor Lacey, sorry to put you on the spot. I just wondered whether you wanted to say anything in closing before we move on to putting our comments together.
No, like I said, I'm new to the RPB, but as you can see and what's being presented, it's a a wide breadth of work that gets carried out, and some really important work. And as you said, the demands on the whole of the service currently are increasing. Neurodivergence, dementia, as you said, winter pressures. You know, that element of not stable funding is always a difficult one. And of course, we're also, on top of that, we're dealing with Welsh legislative changes in terms of eliminate budgets and different things. So, you know, it's a really, really important board, and it's quite, as you said, it's a complicated one. So the report as read is really good, because it, you know, it's not, it unpicks it in some way that it can. But just, you know, a big thanks to my predecessor and Councillor Hughes that was on the RPB board, and obviously Councillor Marshall. You know, still trying to fill those big boots and get my head around everything. But no, thank you for everybody's time today.
Thanks, Councillor Lacey. Right, in terms of the agenda, he says, flicking between screens, we're on to the section now where we form our comments and recommendations. So if I could ask Natasha and Tanya just to stay on a little bit longer while we do that. Neil, can I just hand over to you for this part, please?
Yes, thanks very much, Chair. So what we've got at the moment is if we can ask Natasha to come back with information regarding the bereavement funding. Can the committee be kept posted on the work of the college consortium? Also, can the committee be kept posted with updates about the dementia friendly, and also if information can be sent to members in regards to the brain health programme in relation to the dementia hub. Councillor Marshall's comment about no summaries of the report are possible, if we can have that in future reports. Right. Also, Councillor Marshall's comment about using members to help with access to groups. Are there any posters or literature to share with local shops? Also, comment about taking the conversation back to the RPB about how we can maximise the role of community connectors to community groups. If there's any way we can know who is accredited in the city and wards in relation to the career accreditation. Sorry, I missed Councillor Whitehead's comment about bullet points of the report.
Councillor Whitehead, do you want to just expand on that? And
it's similar to what Councillor Marshall has said, really. It's like condensing it. It's a heavily laden report. And I mean, under sections, we could possibly have the main bullet points that we should be looking at. I know we get intimated to that on the advice of being scrutineers, but it would be also good if the report carried that type of way forward, you know, that system. It just makes it, I just think, simpler when sometimes it becomes a bit repetitive at times. And I just think the main points that we should be focusing on, what they think are the most important points, albeit they'll think the whole report is important. I'm not saying that. But it would be easier for us to read, I suppose, and get a better knowledge and understanding of. Does that make sense, Chair?
yeah, thanks, Kevin. Councillor Whitehead. Councillor Marshall, you got your hand up?
Yeah, thank you, Chair. It's just to clarify, it's more the fact of all reports, not just the one that we have in front of us today, to make us a bit more accessible. We seem to only do the long reports for anything, for full council, for any.
Yeah, agreed.
And I think that should be across the board. Thank you.
Yeah, that's fair comment, yeah.
Apart from those, Chair, was there any other comments or recommendations the committee would like to make in relation to the report?
Did anybody raise any points that haven't been mentioned? I'll take that as a no. That all sounds good, Neil. Thanks. Right, in that case, oh, I've just lost you again. Sorry. I just want to thank Natasha and Tanya for their time and for putting such a comprehensive report together. As Councillor Lacey said, it's a highly pressurised area with, should we say, some funding challenges, let's put it mildly. But thank you very much. Really appreciate it, and thanks for your time.
Thank you.
Thanks. Bye.
Thanks. Bye-bye. And thanks to Councillor Lacey as well. Thank you.
Thanks. Bye.
And thanks to everybody else for your time. I think that's it. That's the meeting closed. Thank you very much.
Sorry, Chair.
Oh, sorry, my mistake. Sorry, Neil.
Sorry, it's just to advise of the next 2 committee meetings. Next one is on the 6th of November. We're discussing the Norse joint venture, a strategic and performance review. And then on the 4th of December, we'll have the violence against women, domestic abuse and sexual violence. Also, just to update you with the action sheet and the outcome sheet, I'm just chasing up comments from officers from the last meeting.
Just before we go as well, I just seen it in the chat actually as well, but there was nothing in the agenda for confirming the minutes of the last meeting. Should that be on there?
So we'll have the 2 sets of minutes for the next meeting. So we'll have the minutes from the previous meeting and the minutes from this meeting for the next agenda.
Okay, lovely. Thank you, Neil. Councillor Screen, you've put contact in the chat. I'm not sure what you mean by that. You're on mute, Alan. You're on mute, Alan. We can't hear you.
Oh, yes, I mute my mic. No, sorry, it just popped up and I thought I had to do something with it. It said send a quick reply. So, you know.
Oh, right, okay.
Sorry, yes, yeah.
Right, I think we are all done now. Neil, I haven't missed anything, have I?
No, that's everything. Thanks, Chair.
Fantastic. Thank you, everyone. Thanks for your time. See you next time.
Thank you all. Good evening.
Bye, everyone.
Good night. See you, John.